October is Breast Cancer Awareness Month.
News 4 is teaming up with Roswell Park to make sure women are screened for breast cancer. Jackie Walker joins us now live from Williamsville. Jackie.
I sure hope folks have been with us over the last 2 hours. We've been giving you a lot of good reasons to sign up for a mammogram, and we've been talking you all through that process. But now I want you to meet someone that you may meet if you are diagnosed with breast cancer. This is Dr. David Crooks. He is a surgical oncologist. Dr. Crooks, does that mean if you're diagnosed with breast cancer that you're going to have surgery?
That's a very good question. Well, there's a lot of parameters with the diagnosis. We will do our surgery. There's innovation going on in the country, including here, about avoiding surgery. But until that day, the answer is yes, you still do get surgery. We just depend on where we do it within the care treatment. Some patients, if their mammogram and biopsy results, lab results, qualify them for chemotherapy up front, then we do that and surgery steps back. Usually those therapies will reduce the size of the cancer and therefore we do less surgery, which is a great thing.
That is totally a great thing. What can you say to women who may be watching who have been hesitant to get a mammogram because they're worried they're going to find something, that you are going to find something? What would you say to those women?
I say to those women, do not be afraid. Please get your mammogram. If there's a family history of breast cancer, ask that individual in your family, be it a mom, grandmom, sister, cousin, what age did they have their breast cancer? And you want to get yours a few years earlier than that because there is obviously a family risk. Do not be afraid of getting your mammogram.
We are standing right now in Breast Care of Western New York. This is a Roswell Park facility. This is in Williamsville, so it serves the north towns. Can women get all of what they need at this location, or do they need to always go downtown?
I would say the majority of their breast cancer care can be done here. We can coordinate surgical scheduling, adjuvant therapies, that means after surgery, things such as anti-cancer pills, which are hormonal therapy done by a medical oncologist, which is in this building. And of course, as I mentioned, the surgery. If you need radiation, that currently is downtown. Other than that, everything is full service here, including genetics counseling.
Dr. Crooks, and of course we talked to a genetic counselor earlier. Dr. Crooks, I had a woman text me, just a viewer texted me and said, Jackie, tell women to get their mammogram even if they don't feel a lump.
Correct.
Would you echo that?
I would definitely. For my ladies watching, husbands watching, spouses watching, 75% of breast cancer is a random event, bad luck. That means you need your mammogram. It's got nothing to do with family history. Mammograms are the best surveillance. And if you have dense breasts, you will get an ultrasound on top of your mammogram to see if something is hiding in that dense breast tissue.
Yeah.
That is imperative.
I hope that you were watching earlier because we did show you a mammogram of a dense breast and show you how difficult it can sometimes be to diagnose it. But that's why we have 3D imaging, right? Dr. Crooks, thank you so much for being with us. One last chance to ask women to sign up for a mammogram.
Please take the time to invest in yourself and have your mammogram done every year. Thank you.
Thank you so much, Dr. Crooks. 1-800-ROSWELL is the number to call. We certainly hope that you will sign up for your mammogram. But stay with us because right at the end of this newscast, we'll be back with everybody that we've talked to in these last 2 hours and urge you one more time to make that call. I'll send it back to you, Don and Jordan.